So my experience with tree planting is in my professional life is that I organised an event with the RCGP, which is the Royal College of General Practitioners, to celebrate their 70th birthday. And the plan was to try and get 70 trees planted at GP surgeries around the country. Luckily, there are many healthcare professionals within general practice who are also passionate about this. We're also really keen to have trees on their grounds for their benefit and the patient's benefit. So personally, I was drawn to planting trees because I got the email from NHS Forest saying that there were fully funded trees available for NHS sites. I work in a very deprived area of North Sheffield, and day to day I kind of see the impact of a lack of green spaces around where our patients live, kind of things like increased air pollution, poorer air quality, and the effects that has on their health, but also their physical health, but also their mental health. And I often talk to patients with mental health conditions about getting out into green spaces. I personally see the benefits of being out in green spaces, and I extol the virtues of being out in green spaces to my patients. So it was kind of just the next step of putting that into practice and actually doing something tangible to increase a small green space and biodiversity around our GP surgery. And there's a lot that can be done, I think, non-medication wise, to help support people with their mental health. Medication absolutely has a role, and I do give out medications quite appropriately, but I also do advise patients about being in green spaces, being in fresh air, looking out on, even if it's just a window box, or walking to your local park and standing on and looking out over the grass. And I just felt this, as a healthcare site, we should be promoting this visually as well. So having a tree on the site would be, a kind of visual representation of that, that green things and green spaces and trees and living things are beneficial for our health. The least impactful patient on the environment is the patient who's not a patient. So it's the patient who doesn't need to come and see you and doesn't need repeat prescriptions and doesn't need investigations at the hospital. So keeping people well and having patient care at its best is the most sustainable kind of medicine.